Hey there, and welcome. If you're a hospital administrator in New Jersey, you're going to want to pay close attention. We are breaking down the state's new Rural Health Transformation Program, giving you a strategic roadmap to help you secure a piece of this absolutely critical funding. So let's dive right in. First, let's just get a sense of the scale here. The federal government has greenlit a massive $50 billion rural health transformation program. That's a historic investment designed to completely reshape rural healthcare across the whole country. A huge, huge opportunity. But what does that actually mean for us here in New Jersey? Well, it means this number. For fiscal year 2026, New Jersey is getting just over $147 million. Now, I know, that sounds like a ton of money, but when you put it next to a $50 billion national program, it means things are going to get, well, really competitive. And this chart, it just lays it all out there. You've got states with huge rural areas like Texas and Alaska pulling in nearly double what we got. New Jersey received the absolute statutory minimum. And here's the bottom line. There is zero room for error. Every single application has to be strategically perfect to get funded. The competition is going to be fierce. So let's start with the most important question, the one you have to answer before you do anything else. Before you even think about writing a proposal, you have to know, can your hospital even apply? This is step one, and it is absolutely non-negotiable. So how do you figure that out? Well, you've got to get your head around New Jersey's very unique dual definition framework. You see, because our state has the highest population density in the entire nation, the usual definition of rural just doesn't fly. So the state created two different ways to qualify. On one hand, you've got the simple path. Your hospital is physically located in one of the 7 state-designated rural counties. Think Cumberland, Sussex, or Salem. Easy enough. But on the other hand, there's a kind of back door. You could be in a more suburban county like Ocean or Burlington, but serve very specific federally recognized rural census tracts. Now, what's really cool about this slide is it shows you how your location directly impacts your strategy. Go ahead and find your facility type on here. If you're in one of those 7 rural counties, you're directly eligible, and you can focus on core needs like infrastructure. If you're in a suburban county with those rural tracts, you're targeted, meaning your proposal has to be laser-focused on serving just those areas. And if you're an urban center, your only way in is as a partner. Okay, so you've confirmed you're eligible. Great. Now it's time to choose your lane. The state has broken down the funding into 5 totally different initiatives. The best way to think about this is like a menu of options. You've got to pick the one that aligns best with your hospital's biggest needs and your greatest strengths. First up is RHT1, Workforce Development. And the key word here is sustainability, not just throwing signing bonuses at people. The state wants to see clever ideas like grow your own pipelines with local colleges or plans to upskill the staff you already have, training RNs to become advanced practice nurses. Next, RHT2. This is all about stabilizing the safety net. Honestly, for most hospitals, this is going to be the main lane for direct capital investment. If you need to upgrade your ambulances, modernize your ED, or get help moving to value-based care, this is your funding stream. Now listen up, because Initiative RHT3 is a big one. It's designed to break down the brick-and-mortar walls of your hospital. We're talking mobile health vans, regional telehealth networks. But here's the single most important part. This category mandates partnership. A standalone application for RHT3 will fail. You absolutely must have a partner. RHT4 is all about moving upstream, tackling the social determinants of health. This is where you can get really creative with community programs. Think about things like food pharmacies, where doctors literally prescribe healthy food, or setting up doula programs to improve maternal health in rural communities. And last but not least, we've got RHT5, the Tech and Data Track. This lane is for projects that use technology to manage tough conditions like diabetes or heart failure. It's all about deploying things like remote patient monitoring devices or finally getting your systems connected to the statewide health information network. Okay, but just knowing about those 5 initiatives isn't going to be enough. To actually win, you have to understand what I'm calling New Jersey's secret sauce. These are the state-specific requirements that are going to make or break your proposal. And let me be absolutely crystal clear on this one. The state has seen 1,000,001 generic telehealth proposals. If you just write that you want to do more telehealth, I can almost guarantee your application is going straight to the bottom of the pile. They are not looking for vague ideas. So what do they want? Specificity. You see, the state has already pre-vetted a whole ecosystem of tech partners through the SciTech City Innovation Engine. So instead of being vague, you should write something like this.
that you'll partner with that engine to deploy a specific tool, like the BioBeat cuffless blood pressure monitor. It shows you did your homework.
The second ingredient in the secret sauce is the hub and spoke model. The state's plan is explicit. It names University Hospital in Newark as the official state-supported hub for emergency and trauma care. Your strategy, then, should be to position your hospital as an essential spoke that can leverage that hub for support. All right, you've confirmed you're eligible, you've picked your initiative, and you know the secret sauce. Now let's talk nuts and bolts, the practical roadmap for actually building and submitting your winning application. Get your calendars out, because these are the dates to know. The award was announced back in December. Right now, the state is finalizing the rules. But the part you really need to focus on is the application window, which is projected from March to May of 2026. You should expect a very, very tight 60 to 90-day turnaround. You have to be ready to hit the ground running. And listen, you can't hit the ground running at all without these two things. These are total deal breakers. Your hospital must have an active vendor ID in the state's NJ Start portal, and your SAM.gov registration has to be current for federal compliance. If these aren't sorted out, you literally can't even hit the submit button. Finally, let's talk about how you're going to be scored. It really comes down to three things, each weighted equally. First, need intensity. Are you targeting the communities that need help the most? Second, innovation integration. Are you using those specific tech partners the state wants you to use? And third, sustainability. What's your plan to keep this amazing program going after the grant money runs out in 2030? So it all comes down to this. The money is tight, the competition is going to be intense, and the clock is already ticking. You have all the pieces of the puzzle now. The only question left to answer is, what is your hospital's transformative idea? The one that will not only win this grant, but will truly reshape healthcare for your community.